Imagine waking up with a fever, chills, and a strange button-like sore on your skin, all after what seemed like an innocent encounter with a household mouse or a tiny mite. What if these mild symptoms were the sign of a little-known infectious disease, quietly circulating in city apartments and rural homes alike? Today, we unravel the mysteries of Rickettsialpox, a rare but intriguing illness that blurs the lines between everyday pests and hidden pathogens. Let's break down everything you need to know about Rickettsialpox, from its subtle symptoms to how it's diagnosed, treated, and most importantly, how you can prevent it. Rickettsialpox, what is it? Rickettsialpox is an infectious disease caused by the bacterium Rickettsia akari. Unlike many infections we hear about, Rickettsialpox is not spread from person to person, but through the bite of infected mites, tiny creatures often found living on house mice. These mites can transmit the bacteria to both mice and humans, turning a simple mouse infestation into a potential public health concern. Although Rickettsialpox is considered a mild illness, its symptoms can mimic more serious diseases, and its unique presentation has captured the attention of doctors and scientists for decades. Rickettsialpox has been reported in various parts of the United States, as well as in Russia, Korea, and Africa, essentially wherever mouse populations thrive in close proximity to humans. Symptoms: recognizing Rickettsialpox. The first sign of Rickettsialpox often appears exactly where the infected mite has bitten the skin. Here, a small button-like sore develops, typically within a few days. This sore is distinctive. It's covered by a black scab known in medical terms as an eschar. Over time, the eschar can leave a small scar, marking the spot where the bacteria first entered the body. About a week after the initial bite, more general symptoms begin to appear. These include fever, often accompanied by chills and bouts of sweating, headache, sometimes severe enough to interfere with daily activities, sensitivity to light or discomfort when eyes are exposed to bright lights, muscle aches, which can affect various parts of the body, a widespread rash that covers much of the body, which may be mistaken for chickenpox or other viral rashes, swollen lymph nodes near the site of the bite. Despite these symptoms, Rickettsialpox is usually mild compared to other rickettsial diseases. Most people recover fully, even without specific treatment, but the symptoms can be uncomfortable and may last for several days. Diagnosis: how doctors confirm Rickettsialpox. Diagnosing Rickettsialpox begins with a careful evaluation of the patient's symptoms, recent exposures, and physical findings. The presence of an eschar at the site of a mite bite, combined with fever and rash, can strongly suggest Rickettsialpox to an experienced doctor. To confirm the diagnosis, doctors may perform specialized laboratory tests. The most common methods include biopsy and testing of the rash. A small sample from the rash or eschar can be examined for the presence of Rickettsia akari using immunofluorescence assays, which highlight the bacteria with special dyes. Polymerase chain reaction, PCR. This advanced technique can detect the genetic material of Rickettsia akari rapidly, providing a quick and accurate diagnosis. Blood tests. Doctors may look for antibodies, proteins produced by the immune system in response to infection. Because it takes time for the body to produce detectable levels of antibodies, these tests are often repeated 1 to 3 weeks after symptoms begin. An increase in antibody levels over time can confirm recent infection. It's important to note that antibody tests are not helpful for immediate diagnosis, as they don't become positive until later in the illness. Therefore, clinical judgment and direct testing of the rash or eschar remain critical in the early stages. Treatment: managing Rickettsialpox. The good news is that Rickettsialpox is considered a self-limited illness, meaning most people will recover without any specific treatment. However, antibiotics can help shorten the duration and severity of symptoms. The antibiotic of choice is doxycycline, taken by mouth for about 5 days. Doxycycline is effective against a wide range of rickettsial infections and is generally well tolerated. Early treatment can reduce the length of fever, control the spread of the rash, and speed up recovery. For people who cannot take doxycycline, such as pregnant women or those with allergies, alternative antibiotics may be considered, but consultation with an infectious disease specialist is recommended. Supportive care is also important. This includes rest, staying hydrated, and using medications like acetaminophen or ibuprofen to reduce fever and relieve pain. Prevention: protecting yourself from Rickettsialpox. Preventing Rickettsialpox centers around controlling the population of house mice and the mites that live on them. Here are the most effective strategies. Mouse control. Seal up holes and cracks in your home's walls, floors, and foundations to prevent mice from entering. Remove wood piles, leaf litter, tall grasses, and brush from around your home, as these provide shelter and nesting sites for mice. Store all food, including pet food, in airtight, mouse-proof containers. Environmental hygiene. Regularly clean up trash and debris, both inside and outside the house, to make your environment less attractive to rodents. Use of pesticides. In areas with known mouse infestations, carefully using pesticides can help reduce the population of mites that carry Rickettsia akari. Be sure to follow all safety instructions and consider consulting pest control professionals. Personal protection. If you must handle mice or clean areas infested with rodents, wear gloves and long sleeves to reduce your risk of bites from both mice and mites. By taking these simple but effective steps, you can dramatically reduce your risk of encountering the mites that transmit Rickettsialpox. In summary, Rickettsialpox is a mild but fascinating disease, linking the worlds of rodents, mites, and human health. While rare, it serves as an important reminder of the hidden risks posed by common pests and the value of good household hygiene. If you found this video informative, don't forget to like, share, and subscribe to MediByte. Hit the bell icon so you never miss our latest updates on rare diseases, medical mysteries, and practical health tips. Stay safe, stay healthy, and we'll see you in the next video.